Hello and welcome. My name is Oscar Mason. I'm one of the dentists here at the practice. I would like to take this opportunity to thank you for your patience and understanding over the last few months. I understand there is still a lot of concern about the virus, and over the next few minutes I'm going to take you through the measures that we have put in place as a practice to keep you and our staff safe. In designing these measures, our overriding principle is to minimise the contact that you have with our environment and to look to maintain social distancing wherever possible. The new measures start a couple of days before your appointment, when a member of staff will contact you and ask whether you are experiencing any symptoms of COVID-19. They will also ask you to confirm any changes to your health and explain the new appointment journey. When you arrive at your appointment, we ask that you either remain in your car or wait outside the practice and telephone reception to let them know you have arrived. We will again confirm your medical history and ask you to come to the door when we are ready to receive you. You will be greeted by a member of staff and asked to wait while we take your temperature with our radar thermometer. You will then be able to come into the practice unless you are showing signs of COVID-19. We will then ask you to cleanse your hands with an alcohol hand rub and give you a surgical face mask to wear while you are in the practice. We will ask for payment ahead of your appointment to minimise the risk of spreading infection on your way out of the practice. You will then be guided to a side room and asked to leave any belongings or coats in a plastic box to reduce the risk of contaminating your belongings whilst in the surgery. We would ask that you only bring essential items with you into the practice. You will be directed to a hand washing station to use detergent and warm water to fully cleanse your hands. You will then be led to the surgery and given a plastic bag before entering the room. You will be asked to take a seat and remove the face mask, placing it in the plastic bag. You will be given a mouthwash to use for 1 minute and asked to spit into a cup. We will then provide you with appropriate personal protective equipment before the examination or treatment can begin. On completion of the appointment, we will remove your protective equipment and ask you to replace the face mask from your plastic bag. You will then be asked to wash your hands again before leaving the surgery and escorted by a member of staff to retrieve your belongings. On leaving the practice, you will be asked to remove your face mask and dispose of it in the bin provided and use the alcohol gel again before you exit the practice. Any further appointments you require will be made by telephone. I understand this is quite different to the last time you were here, but don't worry, we'll be there to guide you through the new routine. We look forward to welcoming you back to the practice.